Welcome to another broadcast from mindyourhealthcast.com. We just had completed a 3-session broadcast series on vaccinations that I hope you have had an opportunity to look at, and if not, you can go back because they still are available at this point on YouTube. We, of course, could have gone 5 at least, but tried to give you some highlights basically to provoke your thinking and your curiosity and get you to looking into it for yourself. I gave you some good resources if you have not watched the series. On the 3rd series, we gave a lot of resources of places you can go for information. As you probably know, the medical establishment, the pharmaceutical establishment, and of course mainstream media kind of gives one side of the story and avoids the others, and sometimes when even people within the ranks, meaning other doctors, researchers, attempt to look into it in detail and note relationships between health problems and vaccinations, they can be destroyed, or almost, as we mentioned in the case of Dr. Wakefield. But that's all in that broadcast. But just to remind you that if you did not see it, you might want to go back and view the 3, because you may find that your assumptions about vaccinations are not quite what the truth of the matter is. So today we're going to talk about a little bit of, again, thought-provoking information. I want you to always not take my word, and these are all my opinions. My opinions are based on lots of research and years of study and clinical practice and seeing the people who came out of medicine with all kinds of health problems that either were created by medicine or that they were unable to deal with. And so I would say at least my opinion is an educated opinion. If you go and dig into the material yourself, then you can have your educated opinion. But the problem is that very skillfully, the other side of most of the stories, especially related to medicine and pharmacy, are kind of shadowed or put in the closet and locked up so that you don't get a chance to even know that it exists. But I'm suggesting that no matter what it is that you look into, that you are being presented by the media, the publications, the medical establishments, or whatever it is that is put out, it would behoove you to just do a little digging beneath the surface. So I've kind of entitled the program today, Medicine, the Dark Side, Sorcerers, Demons, and Fairy Tales. Now, it probably sounds a little screwy, but the fact is that I'm going to define what I mean by each of these as we go through and give you some examples. Unfortunately, as I mentioned before, as it related to drugs, a lot of the information that's out there is not readily available, and it's not talked about, and many times you don't know it exists. I believe I've mentioned before about one of the drugs that's on the market right now that there were problems with it before it was released. However, that was kind of obscured so that it got on the market, and at least 50,000 people dropped dead with it. And the bad thing about it is that the drug is still on the market, and because it was kept out of the press, nothing was ever done about it. I can just imagine if there were an herb, even one, and in fact I know of a case, one of the herbs was on the market being sold as a food, because herbs have not been considered drugs or medicine for years in this country. They're considered food products, and as such they don't fall under the classification of drugs until now. The pharmaceuticals are trying to drag it in and make it a part of that, and we'll talk about that a little later. But at any rate, the one herb, chaparral actually was the herb, one person who had taken an excess amount of chaparral, which is a very strong cleaner of the blood, lymph, and body, taken a large amount of it, and their liver became inflamed. Now, the interesting thing is that there was not any established causal relationship. It's just when they interrogated the person, they found that they were taking this particular herb chaparral. So, what happened, one instance of possible, they pulled it off the market. And it was unavailable for a good bit. But there was, here we're talking 50,000 people dropped dead, the drug is still on the market. We're talking one herb possibly might have been involved, but maybe not. And it's immediately pulled off the market. Now, it's interesting to me how this thing operates. Another case was tryptophan. I'm sure you remember that by now. I'm just throwing this in to show you how this whole thing operates. Several years ago, a lot of people were taking L-tryptophan, which is an amino acid, one of the 20-some amino acids that are known to be needed in the body. And a lot of people evidently were low in it because when they took the tryptophan, they found that they felt less depressed, they slept better, and so forth. And so it was selling very well as a natural supplement. Well, all of a sudden, several people developed some type of a problem where they had muscle pains and so forth. And what they found in common that these people were taking tryptophan. So immediately the FDA pulled the tryptophan off the market. They called every company that sold it, every distributor, and they then from the distributor got the list of all the doctors and or health food stores that bought it, and the FDA went around to every store and took all the product as a dangerous product. And of course, sometime later, it was determined two things. That number one, a particular batch of tryptophan had been contaminated from Japan, and that it was actually the contamination that caused the problem, not the tryptophan. Interestingly, the product that was helpful in correcting the problem was pure tryptophan that was not contaminated. Now, I'm only making some assumptions, which I would call educated assumptions, based on the whole context of this happening. Number one, all the amino acids pretty much in this country have come out of Japan. They've been coming out of there for years, and there's never been a problem with any of the amino acids in the way they've made them. Number one, I find it strange that this particular batch of tryptophan that newly came into the country contained a contaminant. Now that's strange in itself because the Japanese are very meticulous in what they do, and as I say, for years, huge amounts of amino acids have come out of Japan with no problem. So that raised a question to me. Number two, it's interesting that pure tryptophan without the contaminant actually improved the problem that they said was caused by the tryptophan. But, of course, it was later established that tryptophan had nothing to do with it. It was a contaminant. Number three, the thing that's intriguing to me is that 2 weeks after the tryptophan was pulled off of the market, a drug called Prozac was released on the market for people for depression and not being able to sleep because of depression. I just have to think that there's a suspicious link somehow between the fact that this new drug, Prozac, was going to be released on the market and the public relying heavily on tryptophan to do the same thing without any adverse effects that the Prozac was supposed to do. And of course, as I've mentioned before, and I don't know if you remember, I don't know if you even heard it, but interesting to me that many years ago, another drug came out on the market it didn't get out on the market, it came up and ended up, they didn't let it go on the market, called LSD, lysergic acid dimethylamide. Anyhow, LSD was manufactured by this pharmacy company to be put on the market for people to be treated with. And of course, as it ended up, it became an illegal drug with a lot of users. It created all kinds of hallucinations, and many people were so on such a high and hallucination that they jumped out of windows of high buildings and did all kinds of things to themselves under the influence of the drug, which was so powerful that only a few micrograms, a millionth of a gram, had a tremendous effect on the brain. Okay, now, what they actually worked on were the serotonin receptor sites in the brain. And the cases where they used this drug, it actually stayed in the brain, and it kept over and over affecting these receptor sites, and so the people would have spontaneous return hallucinations from the drug. Well, anyhow, it became obvious it was not going to be a drug to put out on the market. There was no way they could get around it. It got all the publicity of what it did to people's brains. So things were quiet for many years, and all of a sudden the same pharmaceutical who put out the LSD put out Prozac, another drug that affects the serotonin receptor sites in the brain, but not as powerfully. So it gives you like a low-level trip, and that's why it's been referred to as a mood brightener, because it does put you on a bit of a trip. So it doesn't really solve any of your problems, but it certainly makes you not care. It's almost like taking a lot of alcohol to avoid something, and after a while, you don't care whatever your problem was because you're in another state with the alcohol. So anyhow, this comes out of that dark side of medicine and the pharmacy industry, and there's no way you can separate it because MDs are involved with the pharmacy. MDs work for them. MDs do research for them. MDs are paid to do many studies in their office with it. And so they're all tied together. The MDs have no excuse for not being informed about what drugs can do, but I have to say that probably a lot of them very ignorantly go ahead and accept whatever the pharmaceuticals tell them and go ahead and put it on the market with their patients. And down the road, there's big problems. Now, if you haven't noticed that the biggest competitor of the pharmaceuticals on the advertising media of the various sorts happen to be attorneys. So you've got the pharmaceuticals and the attorneys. Pharmaceuticals are telling you need to take this or you're going to die, or if you want to be healthy, or if you want to prolong your life, and the attorneys are following right behind saying if you've taken this drug, contact us because there's all kinds of risk and health problems involved with it. Now, I don't know if the general public just doesn't bother to listen to that, or they'd rather not hear it, but they still seem to maintain a big trust in the pharmaceutical interests. I know it from the other side. I know people who work for them. There's whistleblowers on them, and some of those you'll find if you go to some of the sources on the vaccinations. People that have worked for them and come out and know what goes on the other side. I mentioned before on my vaccinations about the polio vaccine being contaminated. They knew it was contaminated. They opted to release it on the market anyhow because they didn't want to have to go back and come up with another method to produce it and take the time and expense. They were ready to start recovering money from the vaccine, so they chose and opted to put it on the market knowing it was contaminated with SV40 virus, which is a simian or monkey virus which is tumor producing in the human body. So they did it anyhow. So to me that represents a certain amount of unconscionable action. Now again, these are my opinions, but I believe that if you have an interest in your own health, especially as it relates to modern medicine and medications, that you certainly might want to look into a lot of this. The information's out there, but it never gets the mainstream news. And of course, I can understand why. You know, everything is money driven, as you probably know by now. And if you don't, it's probably time to wake up. You know that the major income anymore for all the advertising that's sold on the TV and magazines and so forth comes from the pharmaceutical interests. You know that they're not going to spend millions of dollars a month in advertising if they're not making multi-millions of dollars back from that advertising. It's just not economically feasible to do that. So when they run several $1 million for a 30-second ad, then you know that they anticipate that they're probably going to make $100 million back from that ad. And that seems to be the way it goes. But on the other hand, as I say, right behind them are the attorneys who are coming along and handling it. And there's internet resources. You can go and see what drugs currently have been either pulled from the market because they've gotten such bad press that they had to pull them. Too many people were dying. But the big thing is that I have found out, if not a lot of people are dying or damaged from something, at least in the news, then it's not going to be pulled from the market. It's going to still be there. And as I said, the one I mentioned earlier, the antiarrhythmic drug, if you go into PDR, it's still there. It just has some black letter wording which says, caution, this drug has been associated with excessive mortality. Now, you know what that means? A lot of people died from it. And I say 50,000 is a lot of people. But it's still there and it's still available. But there's just so much, in my mind, so much deception anymore. The medical industry was not an industry at one time. It was a healing art. And the healing art, the doctors who got into it, went into it with the anticipation that they would learn things that they could use to help people improve their health. And they had no anticipation of becoming fabulously wealthy because there wasn't any big money in it. All the doctors I knew when I were young made an average living. They didn't make a whole lot more than anybody else, and they worked long, hard hours. Most of them were on call 24 hours a day, 7 days a week. They would come to your house in an emergency. In my own particular case, the doctor told my mother when I was very young that I had a problem with one of my ears. After just recovering from measles, I developed what would be called a mastoiditis, an inflammation of the mastoid bone. He said if what he gave was not going to help it, he would have come by the next morning and taken me to a hospital because the only other treatment for that in that day was surgery. And the interesting thing was, the reason he said that was, number one, there was no ambulance service that would come out because we had just had a tremendous snowstorm, but he drove out in a snowstorm to my house late at night, and the next morning he would have been willing to drive me into the hospital in the snow, heavy snow, and that was what type of doctors were in business back then. And it wasn't a business, it really was a healing art. They had to study harder and longer and learn more because they were self-sufficient. And now what we've developed is we've developed the medical industry, the business of medicine. And I'm not saying that there's not doctors who get into it still with the intent of helping people, but the ones that do and are honest, after a while, they are finding that what they're doing isn't really getting people well, and so they start looking for other ways. Now, sometimes they get away with doing that for a while, but I personally know of several doctors who, medical doctors, who lost their license because they insisted that they wanted to treat people in a way that could get them well. And see, the business of medicine doesn't want that anymore. They want people kept into the machine and continually being run through it. And it's not a drive to get people well. It's a drive to appease people enough to keep them coming back. And that's what I consider a part of that dark side of medicine. And they have, what I should say, they have kind of utilized some various methods of scaring people, keeping them in, or in a sense deluding them as to what's going on, and to keep them away from other things, to keep them in the fold. If you haven't noticed, when I grew up, hardly anybody was taking a medication unless something really unusual had happened. The average person didn't take any medication. When I was young, I wasn't on medication all the time, and I wasn't at the doctor every 2 or 3 weeks for antibiotics and so forth, because the people just didn't do that. They didn't need it. But now, all of a sudden, everybody you meet is on 5 to 25 drugs forever. They don't get well, they keep taking the drugs. And when they go in for acute problems, the methods that are used to turn off the immune system and turn off the symptoms so you feel better are not correcting the problem. And there doesn't seem to be any real interest in correcting the problem. The interest is, here, take this. If you don't feel better, come back and we'll try something else. That's kind of the routine. But the things they give you are really not going to cure, and they're not aimed at curing. They're going to suppress the symptoms. You'll feel better, and you think you're okay, because we've also been programmed to think that symptoms are bad and no symptoms mean good or healthy. But if you understand that your immune system is designed to get rid of things that should not be in the body, and the way it does it, we keep emphasizing this, but I want it to click, because it still doesn't seem to click. I have people I've worked with, and it's still not clicking. So I know hearing it one time is not going to do it. The body, when it has something and has gotten inside that does not belong there, it creates something called an inflammatory response. That's an immune response. That means that you have redness, heat, swelling, and pain, the 4 signs of inflammation. Those are not bad, but they don't feel good. Of course, if you have a sore throat and your tonsils are swollen and they're red and they are hurting, and maybe sometimes you develop a fever, which is the 5th symptom, if it's significant, the body will initiate the fever response on top of that. All of those are part of the immune response. None of them feel good. So what do most people do? They go to the doctor. He doesn't know why. He said, well, you have tonsillitis. Now, some people say, oh, okay, that means they know what's wrong with me. Tonsillitis is not a disease. Tonsillitis is an immune response. The question is, why is the body having this immune response? What is it trying to get rid of? But it just doesn't seem to connect. So what they do is they take antibiotics and or steroids if it's really bad or if it doesn't seem to respond, and that turns off the immune system. The people feel better. They think it's all solved. Now, a month, 2 months, 3 months later, the body decides again to try to get rid of it. So what does it do? It provokes an immune response. And an immune response is redness, heat, swelling, and pain. We keep saying that over and over until it really sticks in your head. Redness, heat, swelling, and pain, and or fever if it's significant. Now, what do you do again? You go back to the doctor and get some more antibiotics and whatever he's giving you to suppress it, an antipyretic, which means a drug to get rid of your fever, and a drug to get rid of the immune response. Now what happens? Okay, you feel better. Is the problem solved? No. Did anybody know what the problem was? No. Tonsillitis is not a diagnosis of a disease. Tonsillitis is an immune response. Now, I hope it begins to click. I keep repeating it because I just have learned over the years that it takes a while for something to really sink in till you say, oh, yeah, now I understand. So, what does all that do? It keeps you coming back, and you're going to keep coming back. I've had people who come in to see me that are 80 and 85 for some little thing, and they've not been to a doctor in 30 years or 40 years. I've even had some that have never been to a doctor before, and the only reason they came to me because they heard that I use natural stuff. And they aren't on 5 to 25 drugs, and they're 80 or 85 years old. And I mentioned before, and it's true, I had a lady moved in from another state. She ended up coming to see me because she had some little thing going on. It was very minimal, and of course it cleared up in no time because her body had not been destroyed by taking medications. Well, what I found out is that she never had a doctor, that she spent 85 years without having to take any drugs, antibiotics or otherwise. And so she told me this story. She said, I decided that at my age, here I am in a different state, that if I should have an accident, should fall, get hit with a car, or whatever might happen, I would like to have a medical doctor so that I could be admitted to the hospital and have that kind of oversight. And so she said, I went to a doctor, went in the office, and they had me fill out a history form. And the nurse sat down with me, looked at the history form, and said, you don't have your medications listed. And she said, I don't take medication. I don't have any. The nurse looked at her again and said, you don't understand. We have to have a list of the medications you're taking because if the doctor wants to prescribe something, he has to know what you're taking. She said, you don't understand. I don't take any medications. So the nurse left, came back with the doctor. He repeated the same routine with her and finally said, well, I can't take you as a patient because you refuse to tell us how many drugs you're on. Now, what does that tell you? It tells you that the doctors and nurses in today's world cannot even believe that one could be 85 years old and not on a handful of drugs every day, because they think you have to be taking drugs. Now, that's where medicine has gotten to, and that's part of the problem about the dark side of medicine, is that within the system is built in this idea that we have to have the people keep coming back, and we have to keep peddling them these drugs that they have to take. And of course, it's a tremendous business. I mean, what better business could you ask for than one where the people fear for their life if they don't take what you're selling? Of course they're going to keep coming back. And the doctors, I believe a lot of the doctors believe that. They're told by the pharmaceuticals they have to take this drug, and if they don't take it, they're going to die. So what do? They tell the patient. Now, sometimes I think that's only the doctor doing that. I think the patient's resistant to wanting to take something, and so he says, you have to take this or you're going to die. And I've had people come in and tell me how angry the doctor got because they would not take some particular drug or group of drugs that he wanted them to take. And they finally decided, I don't want that, I'm not going to take it. So this is the part that has bothered me, is that we've gotten away, as I say, from the art of medicine to the medical industry, so everything ends up being profit and money driven. So everything that's done anymore is unfortunately bad in that respect. There's a book that I had gotten some time back called Overtreated: Why Too Much Medicine is Making Us Sicker and Poorer. And it's a pretty good overview. This lady has investigated this pretty thoroughly and looked into the whole idea of modern medical care. And that's what she has come up with, that people are being overtreated. They want to keep them coming back. They want to make the most out of them that they can. There are a lot of people who don't have insurance, so the ones who do have insurance are going to get abusively treated. And it's the same is true with diagnostic tests and everything else. If there is enough, if they can get coverage for it, and the introduction of Medicare and Medicaid kind of made it worse. It helped the doctors, instead of lowering fees, to increase fees because they saw what other people were charging, and some of the doctors who had charged less with the Medicare and Medicaid ended up having to charge more because that's what they paid. And of course the patient wasn't paying it directly, but of course nothing comes from the government free. Somebody has to pay that money in. It always amazes me when I have somebody say, well, the government pays for it. It doesn't cost anything. Where does that money come from that the government has to pay for it? It comes out of somebody's pocket. Somebody's paying for it. There's nothing free. Many years ago, I read that there's no such thing as a free lunch. In fact, Barry Commoner made the idea in a book on ecology many years ago when he was saying there's three basic rules. One, everything goes somewhere. Number two, everything's connected to everything else. And number three, there's no such thing as a free lunch. And so there is no such thing as a free lunch in medicine. I mean, insurance is paying, but somebody's paying that money in or they couldn't pay it out. And it certainly is not free. And if the government's paying it, somebody's paying the money into the government for it to come out. It's still not free. So nothing is free. But it's a good book, and it is thought-provoking, and it would be a good one for you to read. It's one that I should put on my website of books, and it's possible it's on there already. I don't know. I have to look. But anyhow, I have that available. And so what I'm talking about is that you need to understand a little bit about the history of medicine anyhow, as you go back in medicine and look at it. You know, back in the 1700s and the 1800s, medicine really wasn't extremely popular. Now, people don't realize that. But it was a, quote, new field, relatively speaking. And consequently, they did some things that probably turned the public against them. They started doing autopsies, and people weren't real happy with cutting up human bodies back then. And they weren't real real happy about that aspect. They somehow got the feeling that the physicians were just a bit on the shady side, to say the least. And of course, the sources of their bodies for dissection, they didn't always ask where they came from, but there was a business back in those days of providing corpses for dissection, which was the autopsies or studying of the body. And what would happen is that originally, right after someone was buried, these people who had the business of providing corpses would sneak in at night and take out the body and then fill back up the grave before it had leveled out, so no one knew that they had done it. And so they were stealing corpses to provide the study for the doctors. And so eventually that kind of came out and people were not real happy. Well, it ended up that they became more guarded. It wasn't so easy to get to the corpses. And so they either had to steal them from a undertaker before they got buried, or some of them got more resourceful and they would go out and catch travelers traveling along the road, and then they would bring a corpse in to the doctors to work on with a fractured skull. And the doctors pretty much knew that they were killing people to provide the corpses, but it didn't seem to bother them too bad, so they went along with the illusion that they somehow found them that way. And that's how they did studies. So a lot of shady things came out about medicine, so they weren't so happy. And then, of course, as physicians began to practice more, there were a lot of the things. Now, we're talking back in the 1700s, especially right now. Physicians were kind of looked at as maybe necessary pains in the neck. People kind of trusted them, but they didn't trust them too much, and it wasn't a highly respected profession at all. And then along came the surgeons, and of course the surgeons were looked down upon by the physicians as a low-class type of practitioner, almost like a mechanic. Because the physician felt that we are the superior ones, we have the knowledge, and we can diagnose and prognosticate. The surgeon just come along cutting off pieces and things like bloodletting and all that, they were kind of relinquished to the surgeons, and so no physician wanted to be looked at as a surgeon. They wanted to be a physician. So there was a split for many years. But the interesting thing is that over the years, it appears that the surgeons fine-tuned what they did to the point that they started getting more respect. But eventually, there was 2 licenses. Now, see, most of you are probably not even going to be aware of that, but at one time there were 2 licenses, and I still remember that. So you could have a doctor's office, there would be a sign-out physician, or there could be a sign-out surgeon. 2 separate licenses. But some of the doctors decided to be more enterprising, so they would be both a physician and surgeon. And I remember that. I remember a new doctor coming to our town, and he put up his sign, physician and surgeon. And so as surgery gained more reputation of being able to do a lot of things, which they did, especially in emergency medicine. They were able to put people's bodies back together. They would be able to do a lot of things, and then eventually in corrective surgery for facial injuries, and eventually birth defects, all kinds of things. The surgeons actually fine-tuned their science and art much better. So at some point, guess what? Medicine just grabbed them and took them in and made them a part of medicine. If they were getting more notoriety than the physicians were, then we don't want that to happen. That we're not getting it. So they put it all together. And of course, now surgery has become a specialty. So anyhow, as it progressed, the whole thing changed. The whole picture of it changed. And what came out of it was that after the 40s, after World War II, the ability to synthesize molecules came along. Before the 40s, what medicine they had were made from herbs. They were basically extracts of herbs, and in some cases they were, depending on what the medicine was, some were made from minerals or mineral compounds. In fact, the early treatment for syphilis was made from a mercury compound, which was very interesting. It would have an effect on the symptoms of syphilis, but at the same time the people would die of mercury poisoning, so it didn't work out so well. And later in the early 1900s we had something developed called Ehrlich's magic bullet, which he switched from mercury to arsenic compound, which also was extremely toxic, and so that fell by the wayside too. But at the time it looked like it was really helping the syphilis. Unfortunately, as I say, the people were then getting sick and dying from arsenic poisoning. So those were some of the things they were working with. In fact, I have, and I mentioned before, a Merck manual of the therapeutic substances that were on the market and through the late early 1900s, and this one was published, I think, 1898, and it only has about 700 or 800 different herbs and chemical substances and metals that were their whole pharmacy. And then as time went on, of course, World War II came along. The need for chemistry to come up with new things, which they did, instead of silk, they developed nylon. They developed a lot of synthetic fibers, and they found out that they had the capability of producing new molecules. Okay, now it didn't take long for the pharmaceutical industry to develop, and realizing, wow, if we could make, instead of using herbs, if we could synthesize a molecule that had a very specific inhibiting or overstimulating effect in the body, then we can patent it, and if we can patent it, we can control what we charge for it. Nobody else can compete with us. And so after World War II started the development of the pharmaceutical industry as a major player. Now, up to that point, it had not been. But now, all of a sudden, things are changing. And then along comes new diagnostic equipment, things like x-rays, and, more used than before, and more sophisticated type of x-rays like CT scanners and so forth. So, bit by bit, that came along. Then the laboratory work, they learned more about the blood and developed test components of the blood. So all of that together, by in the 50s, medicine was starting to really grow and become highly recognized, to the point that people were awed by it. You could go into the doctor, and he would have you draw blood and do all this laboratory work. He could send you for these diagnostic imaging studies. He could do, it looked like, wow, they're doing a lot. And then, of course, antibodies came out that really suppressed all of your immune functions, made you feel better. And so, bit by bit, this whole thing grew. And I grew up watching all of this change. So most people don't have that advantage now. They just were born into it. They think that's the way it's always been, which is not true. And very few people will go back and study the history. So I'm trying to give you a bit of the history. But now, of course, along the way, unfortunately, there was a dark side to that. And the dark side of it was that a lot of the doctors, because they had gotten so much recognition, some of them seemed to be like priests. In fact, Dr. Mendelsohn, if you've not read any of Dr. Mendelssohn's books I mentioned before, he wrote a book called Confessions of a Medical Heretic, and he let out some of the stuff that was going on, and that to me is part of the dark side. If you haven't read the book, one of the things that really bugged him was about when he had to spend time in the emergency room as he was training to be a doctor. Down toward the end, he was doing some rotations in the emergency room, and he noticed that there was a standing order that when a child came in with an injury, a cut, a bruise, a break, whatever, broken bone, you name it, they had to take a history, and in taking the history, they asked the question, especially with the boys, does this child still wet the bed, And now that we're talking boys that were 6, 7, 8 years old, do they still wet the bed? Well, if they answered yes, the hospital rule was that they had to send the child over to nephrology, which is the kidney urinary tract specialist. They had to be sent over there if they're still wetting the bed. Now, after a while, he's thinking, now why? What difference does any of that make? The child is coming in because of an injury. We're going to treat the injury, and that should be the end of it. But no, they get sent over to urology and nephrology. So, as he started to look into it, he found out that what they were doing is that the doctors, in order to be certified as a nephrologist, had to do so many catheterizations in order to qualify. And so the hospital was providing them practice dummies, so to speak, of these young boys. And of course it was also known that because of the smaller size of their urinary tract, that the chances of damage to it were much greater than to an adult male. But yet they did that anyhow, and it infuriated Dr. Mendelsohn that they were experimenting and practicing on people without them knowing that. They did it under the guise that they were, that maybe there was some problem with them, is why they were still wetting the bed, and it really wasn't for that purpose at all. It was for the purpose of practice. And so that was one of his early awakenings, and in his book he mentions other things. But what he came to realize is that at that point in history, that the doctors had reached the status that they were considered to be part of the religion of medicine, that the medicine had become a religion. Everybody looked up in awe at a doctor, and so he took on the position of being like a priest. And he wore a uniform, of course, which was his white jacket. Some of his religious implements were the stethoscope that he always carried with him. And of course, in surgery were all the tools of surgery. Those were all the holy implements that were part of that. And that the hospital itself represented a temple of religion. And so he saw how people actually saw doctors, that they were up at this high level. And so anything the doctor would say had to be right, because he was the priest of the temple. And he had the secret of life and the secret of healing, and so that's how they kind of viewed it. And so he writes about it in his book. So if you haven't read it, it would be a good book for you to read, because it kind of opened your eyes. Now, he later wrote some other good books, one called Medical Malpractice, how women were being exploited by medicine. And see, he was a guy of integrity, and he went into medicine to help people. And so consequently, when he saw some of this stuff going on, he got himself in trouble a lot because he spoke out about it. And bit by bit, he saw that a lot of things that he didn't agree with the way they're being done, and how we were being shuffled more to drugs for everything. And so he also wrote a book called How to Raise a Healthy Child in Spite of Your Doctor. And he also made the famous statement that the worst thing you can do for your health is go to a hospital. And so you can imagine that within the rest of the medical profession, they weren't real happy with him, because he was straightforward and told the truth, and they weren't real happy about that. So consequently, that's only one part of the dark side. The thing that bothered me the most, I guess, is when medicine took a step further, medical people, and experimented on people without them knowing they were being experimented on. So that's, when I'm defining these terms that I've used, that to me probably represented the darkest side, is when they deliberately gave people things that could damage or be fatal, and did so without consent of the person, not because it was to help the person, but for them to gain information for some other reason. In other words, they were using involuntary subjects for study and research without the knowledge or consent of the person. And a lot of that was done. One of the biggies I've mentioned before, but I think in this context you need to be reminded, is the one called the Tuskegee experiment. It was an experiment that went on for many, many years, and it was started way back in the early 1900s, and it was under the auspices in the state of Alabama of the public health services and the CDC, which was not called the CDC then, but it became the CDC, and the medical establishment. They were all in on it, and it involved about 1,400 black men who had developed syphilis, but they never were told they had syphilis. They never were treated with anything, and they had them come in periodically and measured their blood and took a questionnaire of how they were feeling and what was going on, and the only thing they were ever told is you have bad blood, and that's why we're having you come back and checking your blood. But they never told them anything more than that. And they watched these men become sick, disabled, and a high level of them died. And this went on for years and probably would never have stopped until they all died off, with the exception that an investigative reporter got wind of it. He started digging into it, and he published a book, and it's still available, and I think that's on my website, called Bad Blood. And that's what they were told. You can go on the internet. In looking at how this has been done, I found a source, and it's called the Citizens for Responsible Care and Research, a human rights organization. And if you go into their website, you're going to find that they list a whole group of things. The index of infamous research in high-profile cases. Now, you can look up that page, and then it'll take you to a lot more information. But I just was looking to see what's available. I ran into that, and then off of that, there's a specific whole section called Internet Resources on the Tuskegee Study. In fact, it even shows a picture of the head of the Public Health Service when that whole study started with all these people. So that's available, and you know, the information, the internet is probably one of the best things that's ever happened to the average person if you make use of it. Now, it's true that you have to filter the information. You have to look and see what the resources are, but in most cases, you're going to find that you can sort out and find what the real truth of something is. And with vaccinations, you know, when you do that, you won't believe the amount of material you can find. Now, you're going to find some disgruntled people who are ranting and raving and not offering any real solid evidence about anything, but you're also going to find some very reputable people, and they're going to give you the citations, they're going to give you the resources, and you can look for yourself. Now, if you glean anything out of what I'm saying today, my whole purpose is to get you to think, don't take anything at face value. You know, I had a lady just came in recently in my office, and her daughter brought her in, and so she had gone to this doctor, and she had a lot of things going on, but he didn't know what it was. So finally he says, well, I think we should take your gallbladder out. And she says, well, why is that? And he says, well, you don't need it anyhow, it doesn't do anything, and it might be part of the problem. So she submitted to going and having her gallbladder removed, which it ended up there was nothing wrong with it. But I'm saying that to say that medicine is not very well trained in diagnostics anymore. If you can't see it on a picture, if you can't read bad numbers on a blood test, or if you can't see a big bump or lump or growth or something, there's nothing to treat. They don't know. Why do you have tonsillitis? They haven't the slightest idea. Well, for some reason, the tonsils are inflaming. People have been led to believe that the tonsils do nothing for you. The tonsils are lymph nodes, and the lymph nodes are protective of certain areas, and especially in the throat, are protective of the brain, but they're protective of the kidneys. So here, they're there, and people go, and the doctor says, well, you have tonsillitis, and you accept that that's a disease, but it isn't. And so I'm bringing you all this just to get you thinking that most of the doctors don't know, nor are they very much concerned with finding the cause of anything, because that's not what they're trained to do, number one. Number two, their therapies are not aimed at curing anything anyhow. If you look at the drugs out, and you look at the research on the drugs, it says for the management of the symptoms of blah. Now, management does not mean cure. Management means just that. You manage the symptoms. So whatever is causing the symptoms, which means whatever's provoking the immune system, is what the real problem is. but they're not neither trained for nor too much concerned, because even if they knew, they still can only treat the symptoms, because that's what their drugs are for, are the management or the treatment of the symptoms. So I'm telling you all to say that it's just, actually I consider it to have gotten into a bad state, and it's gotten outlandishly expensive when we have to spend $1 trillion a year managing symptoms in people, and then meantime the people are getting sicker, and you'd have to be blind not to look around you and say, are people healthier today? And of course, unless you're blind, you'd have to say no. Okay, so we spend $1 trillion a year to make people sicker. Now, who benefits from that? Not the people. Who's paying the bill? The people. Who's making the profit? Not the people. The medical establishment, the medical industry, pharmaceuticals and doctors. They're all benefiting from it, but certainly not the patient. The patient is merely the fodder to feed the machine to make the money. So I'm hoping I'm getting to you a little bit. Now, I'm just talking about this one syphilis issue, and that to me was terrible, that they would lie to someone and use them as guinea pigs without ever telling them. Now, if you weren't paying attention, and if you were paying attention but had no idea what it was about, President Clinton actually apologized to these people when all of this finally came out and got looked into heavily. He apologized to the few that were still alive or disabled and the families of those that the people died. He apologized to them out of Washington at a public ceremony, and it was put in writing, and they were given monetary compensation for that. Now, I don't know if you caught that. I remember when it happened. I remember seeing it, because that was one of the things that was done in his administration, was to pay off these people who were, without their permission, being used as experiments. Now, it didn't stop with just the Tuskegee. The other big section had to do with radioactivity and radiation. And again, there's a book out called The Platinum Files that was written by a researcher who looked into all the cases where people were treated with radioactivity for experimental purposes without their knowledge. Many people were given whole-body radiation. And they already knew from Hiroshima in World War II that whole-body radiation totally wipes out your immune system, destroys your bone marrow, and you're going to die. You're going to die of something pretty fast because your body has no immunity anymore. And so they did that many, many times in certain hospitals in particular, and it was done with the knowledge of doctors, and it was done with the knowledge of even government agencies that this was going on. And in fact, in many cases, they encouraged it. And so all these people were literally they were destroyed with radiation without their knowledge. And they even went so far that up in the East, at one of the homes for mentally retarded children, every morning in their breakfast cereal they put doses of radiation in their cereal without anybody's knowledge, as far as family or anybody related to them, to see what over time exposure to low doses of radiation would do to your body. So they were, again, used as experimental subjects, and I'd have to say, if there's a dark side, that's pretty dark. And we could go on. There's a bunch of others that are out there, and even with the pharmaceuticals, there's a newer book out now called Blood Feud. That's going to be on the list. The man who blew the whistle on one of the deadliest prescription drugs ever. And it was Procrit. It's a drug that's been given to people under radiation therapy or chemotherapy when their bone marrow is depressed and their blood count goes down, the red blood count. They came out with this drug that's supposed to enhance the production of red blood cells. But of course it has very terrible adverse effects. And the book starts out by citing a case where this guy starts vomiting up from his lung cancer pieces of tumor and blood, and he ends up dying on the living room floor by his wife from having taken large doses of this, because the companies had a contest of a sort, but not a friendly contest, between the developer of the drug and the pharmaceutical who bought the license from them to use the drug, then went back and tried to wipe out from the company who made it, and the company who made it tried to make sales against the person they sold the contract to. In any case, they got in a battle, and so the big pharmaceutical decided that they would, instead of taking smaller doses in a week, the doctors didn't like using it because the people had to come in twice a week to get injections. So they decided to double the dose and do it in one big injection, but it was too much for the body, and a lot of people were injured and died from it. And anyhow, this tells the story of how this all came about because of this competition of salespeople and marketing within the drug companies. And all kinds of things are done like this all the time. And as I say, there ends up being doctors involved, not just the pharmaceutical manufacturers. We're talking about pharmacists, we're talking about PhD researchers, we're talking about medical doctors, we're talking about a lot of people involved in these type of things. Anyhow, that's another case where the pharmaceutical pushed because of making money. And then this drug was selling, they were making billions off of it. And then all of a sudden it was discovered how dangerous it was. And on top of it, they knew that it was dangerous when they actually pushed it. It was even against the FDA's recommendations. I mean, it was a illegal off-label use of the drug. And so it finally came to the surface, and there was a big hassle over it. And so this book tells the whole story from beginning to end about how the whole thing came into being and why it came into being. Okay, so that is the dark side. I think maybe we were talking about a one-session program, but maybe this might be two, as I look at some things that I wanted to talk about yet. But at any rate, we could go on and on. I know a lot more. I know surgeries that were done. I know personally of some people who a doctor experimented on brains by doing surgery in the military and got away with it for a long time. Finally, it was uncovered that he was experimenting on the soldiers by promising them he could help them by doing these brain surgeries, when in fact he was just experimenting with them. And I have had a patient who was one of those people who he experimented on and totally changed his life. He almost died. He became permanently impaired in terms of movement and speech. And fortunately, he survived all of that and came out to be successful in spite of that. But he had years of misery, and in fact, on one occasion, he actually died and came back from that death. But so surgery is the same thing. A lot of times, I know clear back in the 50s, surgeons, some of them, got the idea, and as I said, surgery progressed pretty well, but like in everything else, there were some renegades who thought they could do anything with surgery, and so I mentioned about the Memories Ghost book, about the young man who was in his teens that was having seizures. The doctor decided to suction out pieces of his brain, the amygdala and the hippocampus. Didn't cure his seizures, but he couldn't remember anything after that except old memories. Anything new, his short-term memory was totally wiped out. And so he could talk to you for 2 hours, and if you got up, left the room, and came back, he would not know who you were. He could read a book and lay it down. As soon as he picked it up, he knew nothing about what he had read before. They could train him to do a job, and as long as he was standing there repeating it over and over, he could do it. If he took a break and came back, he had to be retrained again because his short-term memory totally gone. So even surgery, there was a lot of uses out of that. Okay, so I gave you the dark side. Sorcerers. Yeah, I mentioned sorcerers here. And now we go back to some definitions. Way back. The definition of the word that somehow got carried forward to become pharmacy and derivatives of that, pharmacist, the practice of pharmacy, a pharmaceutical, all of those are derived from a Greek word. And the original Greek word had to do with, it was called in Greek pharmakon, that's the word. And the definition is given back from the Greek as a drug such as a spell-giving potion. Now, I thought that's interesting. And some of them even define it to give spell-giving potions as a sorcerer. Number 2 is a druggist or pharmacist who dispenses these spell-giving potions. And number 3, a poisoner, because it's also described as a spell-giving potion or poison. So when you go back, it's interesting that the industry chose that particular word of all the words they could have chosen. They could have called it medical chemistry, they could have done some other things, but instead they picked that particular word. And so a pharmacist today has the same title as was 2,000 years ago in Greek. And to me, some of the dictionaries, now I've done a lot of digging, but they kind of dance around the original meaning and avoid it and tell how it's used today more. But someone found in Webster's Second Collegiate Dictionary, published in 1980, under the word pharmaceutical, it says, pharmaceutical, the practice of witchcraft of the use of poison. I thought that interesting. So, to me, when somebody uses the term, of all the terms they could have chosen, and they picked that particular word, I think they knew full well what it was that they had reference to. And I know that anybody who studies pharmacology realizes that it, in fact, it can be a poison in the case of the one we just mentioned in the blood feud, but it can be a poison in the sense that it can kill you, adverse effects. It can be a poison in the sense that it impairs functions, because for a drug to work as they're used today, now I'm not talking about the old herbs, and I'm not talking about homeopathy, which we haven't gotten into and probably won't get into in this whole discussion, although maybe we will before it's over. In the original use of that, the sorcery thing, a lot of doctors know that if they give a person, that there's a chance that it can hurt them, or maybe some of them just don't pay any attention. I know many don't ever look into the drugs. When the drug detail person comes from the pharmaceutical company and says, here's the latest drug for blood pressure, the doctor accepts whatever the detail person tells them about the drug, and they don't go and start looking, well, now what does this thing really do in the body? How does it work? What's the mechanism of action? Now, interestingly, in many cases, they couldn't find out if they wanted to, because if you go to the PDR will say the mechanism of action of this drug is unknown, meaning they don't have any idea what it does in the body. And they can tell you some of the adverse effects of it, what it does to the brain when you take it, what it does to the... They broke it down into systems. If you've never read the PDR, go to a library, look at a copy of the PDR, and at a certain area under the drug, it will tell the name of it, it will tell you the generic chemical name of it, it will tell you either mechanism of action or theoretical mechanism of action, which means they don't really know, but they think maybe it works like this, or mechanism of action unknown. They don't have any idea why it works. It appears that we have come to the end of our time again, as seems to happen almost every time. What I want to do is to tell you that we'll finish this up. We'll be talking about the rest of our title. We'll be talking more about the demons, and we'll be talking about the fairy tales. And I think you will find that we'll be a bit provoking and challenging with those also, but again, for the purpose of getting you to start thinking and looking on your own, and don't take anything for granted. Go out and search it out with the tools that are available. Then there's no reason why anybody can't find out what they need to know to make a good decision about health or otherwise. I would like to remind you that we have on our website, mindyourhealthcast.com, all of the old broadcasts over the last year, and that they are available on DVDs. We are, of course, have the new ones up on YouTube now, since we have switched from the old streamer, freedocast.com, to the YouTube. Why, they're going to be up there for a while, so you have a chance to see them. But if you want to really get into some of those early ones, and there was a lot of good instructional information, and some with even handouts, you probably would want to go back and get some of the key ones. Anyhow, it was nice being with you again, and so we're going to be signing off until our next broadcast, where we'll complete our subject and talk about the demons and the fairy tales related to medicine today.